So, good morning, everyone. And on behalf of the FSHD Society, welcome to today's FSHD University. Before we get started with today's presentation, just a quick reminder that the session will be recorded and made available on our YouTube channel within the next week or so. We do encourage you to use the chat to interact with each other. Many of you have already let us know where you're from. Thank you so much. Please continue to do that. What we do ask you to do, however, is if you have questions, please use the Q&A section for questions for our presenters. We try to monitor the chat, but it is a little bit harder. So if you submit those questions via the Q&A box at the bottom of your screen, that would be very helpful. Now, in today's FSHD University webinar, we'll dive into the role of strength training and how it may help support mobility, function, and overall well-being. Dr. Nicole Voet, a rehabilitation physician, and Ronne van Haaren, a physical therapist from the Dutch Center for Neuromuscular Diseases, will share insights from their latest research on strength training in people with FSHD. We're extremely grateful to have them on with us today. And without further ado, I'll pass it over to them.
Thank you. Yes, and I will start with a very short introduction. Strength training. We are going to talk about strength training tomorrow, tonight, this evening. I don't know where you are ever in the world. Up till now, I've discussed a lot on aerobic training, but what's the difference between aerobic training on the one hand and strength training on the other hand? Aerobic training is, for example, swimming, biking, walking. And during aerobic training, you are working on your cardiovascular system through continuous longer exercise. So the function of your heart and your lung will improve. And we know from my PhD research in about between 2016 and 2020 that aerobic exercise training is very effective in FSHD, especially on decreasing fatigue, improving your function, and even decelerating the progression of disease. And there are several other trials on aerobic training which shows that there is a very positive effect. Then strength training is something else. During strength training, you are working on your muscles against some form of resistance. And the goal of strength training is otherwise, that's remaining or improving muscle strength. But the ultimate goal can be, for example, to improve the functioning of daily life. And then the next one. And with that, I will hand it over to Ronne. Yeah. Oh, Ronne, you're muted.
Thank you. I'm sorry.
And yeah, then you can show the presentation again. Yep.
Perfect. I'll hide this one. I'll be talking about strength training in FSHD. We did a study about this topic a while ago. So I'll be telling you about a brand new study right now. And as Nicole already told us, we know quite a lot about aerobic training and how it can help in FSHD. But only very few little studies are done about strength training in FSHD, and there are not quite strong results yet. So it is unknown what it exactly can do, and therefore a lot of people don't do strength training if they have FSHD, just to be on the safe side. And in some guidelines, it's even advised not to do strength training. And in our study, we looked into the opportunities of strength training. We know from our clinical work that some patients already have experience with strength training, so that's what we looked into. For part one, we performed some interviews with 10 people with FSHD, 5 who really liked their strength training and had nice results, and 5 people who tried strength training but stopped doing it. And there we learned more about the personal factors regarding strength training. We also did measurements to 10 people with FSHD who did strength training successfully, and we went to visit them in their home gym to learn about their training intensity, and that was part 2 of the study. And together we learned a lot about the opportunities of strength training. First, for the interviews. How did that work? We spoke to 10 people, like I said. We wrote down everything they told us, and then we marked certain areas of the interviews which were relevant for our research question. An example is strength training helps me to become stronger, or I don't know what to do in the gym. And all those quotes together, we formed 5 themes that were really important, that we found really important in these 10 interviews. I will share them now. The first one that we found is really important is a good balance in your daily life. If you already overuse muscles in your daily life, then it will be counterproductive to work on those, to do strength training on those muscles as well. So it's important to have that good balance in your daily life, and Nicole will also explain more about that later. The second factor, we found that, of course, it's important to have initial motivation, but it's also good to think about a sustaining factor, a factor that makes you keep doing the exercise for a longer period. The third thing is that we found that the patients really like the sense of control during their training. So for some people who had a good body awareness, they like to train by themselves and learn what their body can and cannot do. And others like more to rely on trainers, personal trainers, or physical therapists. The fourth thing that we found is that we saw a big link between daily life and strength training. So when your strength training goes really well, this can also positively impact your daily life, but also the other way around. The fifth factor is that, of course, it's very important to have a personalized approach to your strength training. Now I will tell more about the second part of the study, that is the training intensity measurements. So we measured 10 participants with FSHD during their regular training program. So these were 10 people who already performed strength training. They described themselves as successfully in their strength training, and we observed what they were doing. We measured 5 male and 5 female people. They were between the age of 32 and 73 years old. And they had a big variety in FSHD clinical scores, with 1 only having small facial or shoulder weakness, and 11 means severely impacted also in walking, shoulder lifts, etc. So it was a although the group was small, it was a variable group. And we measured 3 things: their training intensity, their muscle fatigue in all the muscles over their body, and whether or not they had compensation mechanisms. And we measured their fatigue threshold, which I will explain more now. For the fatigue threshold, all the people did the leg press exercise. So you sit on a exercise chair and you have to push the weight away from you. And we had some markers, EMG markers, all over the body, but also on the leg muscles, in which we could see how much muscle fatigue is in the legs and the other muscles, of course. And people had to do an exercise. They had to exercise 1 minute at 20% of their maximum strength on this leg press, 30% for 1 minute, 40%, etc., until they couldn't do more repetitions. And now I'll show you the results. On the horizontal axis, you see how much repetitions a person did. So for example, the lowest light blue line, we have 20 repetitions of the leg press. And on the vertical axis, you see the EMG value. So that's a value of how much effort the muscle had to do in order to perform that repetition. And the lowest line at the bottom, the light blue line, that is a straight line, meaning that at repetition 1, you had to perform similar muscle activity to do this exercise compared to muscle 20, because it's a straight line. And the fatigue threshold starts when the line starts increasing, which you see in the middle line. You see repetition 1 is definitely lower than the latest repetition, giving a more steeper line showing muscle fatigue. And we found in the study that most people, the training weight they use in their regular trainings was slightly above, or actually quite a bit above, their fatigue threshold. So in conclusion, they trained a bit higher than their fatigue threshold. And we also looked at other parts of their training intensity. And for this graph, we looked into the maximum intensity that each person could do per exercise. We did this with a 10 RM test. Some people might know it. And with that, you can determine what your maximum intensity per exercise is. And in general, for the group, we found that most participants trained between 45 and 50% of their maximum. And we also had a colleague doing this in people without FSHD, and we saw almost the same results. Most participants performed 10 repetitions per exercise. And currently in the guideline, you see a lot of advice about doing 15 or 20 repetitions per exercise. But in these people, we saw lower repetitions and they had higher intensity, like I told you in the first bullet. Most participants trained around the Borg score of 12 to 14. You see that score in the right corner. It's a score you can use for your intensity in the training, and a score of 12 to 14 means they're training relatively heavy. Most participants, when we ask them after the last after the last repetition of the last set, so we ask it for each exercise, we ask them how much muscle burn they had on a scale from 1 to 10. And most participants scored a muscle burn between 7 to 9, which is quite high, as you can imagine. And we also asked participants after their last repetition of the last set if they could do more repetitions. So how much more repetitions could you do? Some people saying I could do 10 more repetitions, which mean you're not entirely fatigued. But most participants told us they could do no more than 1 to 5 repetitions after their set. We also asked the people if they experienced progression in the training. And most people experienced a reasonable improvement in the training. So meaning they could slightly increase the weights they used in the training. We also asked them about the progression in daily life, and most people experienced a reasonable improvement there as well. We asked them about the symptoms after training, such as pain and fatigue, and most people had symptoms for less than 24 hours, and some people for 24 to 48 hours, and one person had more than 48 hours symptoms. So in conclusion, in this group, we found people who really gave themselves a training stimulus. They trained on average 10 repetitions, but relatively heavy, more than we expected before we started this study. And as a result, they experienced improvement in training, in daily life, and most people had symptoms for less than 24 hours. However, an important disclaimer is that these people already did strength training for at least 6 months, but most people already did it for years. So they had a lot of time to build up to this level of exercise. So they were experienced strength trainers. And now I give it back to Nicole.
Yeah, thank you, Ronne. And it's also nice to say that Ronne recently started as a PhD student under my supervision, also on this trial, and also on an exercise trial in FSHD. And I hope that we can show these results in 2 years. Another interesting thing to say is the reason we started this trial, because we always said as physicians, therapists, patients, be aware of strength training, because we know it's maybe safe, but it's not very effective. But there were several patients in my consulting room who said to me, I'm performing strength training for years, and I think it's very effective. So then we thought, why not measuring these patients, interviewing these patients, and learn from them how they perform strength training, because we can tell them how to exercise, but they already show that it's effective. So I like this form of research. We as therapists, physicians, and researchers learn from you as patients, because you know yourself the best, and you know how to perform things. So I hope we can perform these trials more in the future. Yeah, and then how to perform strength training in daily life, because I expect that you are all here in this webinar to hear from us, how can I apply strength training in my daily life? Yeah, so the next one. So we will give you some guidelines. And the most important thing is what I always say in every presentation is that you as patients are already top sporters in daily life. Daily life is already top sport for you because doing the dishes, bringing your kids to school, going to work, that is already costing a lot of energy when you compare it to people without FSHD. And these people on this slide are top sporters too. They are cyclists in the Tour de France. The Tour de France is a big cycling competition in Europe, especially in France. And these cyclists are top sporters in daily life too, because it's their work. But you can see that these cyclists do top sport, but they do not drive their own car. They do not have to cook dinner. They do not have to make up their bed. And one of my patients said to me once, and they win a gold medal. And I perform top sport in daily life, but I do not win a gold medal. And the reason why I tell you this is because of two things. We have to be aware that when we ask you to exercise, aerobic exercise like cycling, but in this way, strength training, we have to be aware that you are already top sporters in daily life. And everyone understands that these cyclists in the Tour de France do not exercise in the evening after a competition. But sometimes we do ask you to exercise above your daily life. So what's the solution? And first of all, you have to take a look at your daily life. As Ronne said, exercise and training is not only about training, it's also about your daily life and balance in your daily life. You have to have enough energy left after your daily life activities to spend it into exercise. Because if you do not have any energy, then it will lead to overuse training. So take a look at your daily life and see, are there any things that I can do in a different way? For example, several micro breaks, taking rest or doing things in the other way, or ask help if you notice that your energy is not very much. That's one thing. And the other thing is take a look at your daily life activities. Are there activities that you still want to do, but maybe these activities are already exercise? So we are now talking about strength training, but when we are talking about aerobic exercise, it's about the heart rate is guiding you in the intensity, at least if your muscle weakness is not too high. In the Netherlands, we frequently perform a maximal cycling exercise test to know what are your training zones. So which heart rate do you have to apply to exercise? And then it frequently, these results show me that, for example, when you're walking to do the groceries, you are already exercising because your heart rate during walking is already in an exercise zone. But for strength training, it's more difficult because we do not have a kind of a measurement yet for the exercise intensity. But sometimes standing up from a chair, walking the stairs is already exercise. So it's okay if you want to still perform these activities, but be aware that it can already be exercise. And when you want to apply exercise above that, there has to be enough energy and it has to fit in the other activities. For example, if you want to walk the stairs, but it's very demanding for you, and you want to exercise on, for example, Tuesday and Saturday, then take the escalator or the lift on Tuesday and Saturday and perform your exercises on Tuesday and Saturday to prevent overuse, because these cyclists in the Tour de France also do not perform exercises in the evening. The next one. Then, as Ronne also already said, it's very important to, when you want to start exercise or to optimize your exercise, strength training exercises, question yourself, what's my personal goal? Because your exercise, your strength training has to fit your personal goal. And this video, you can start a video, will show you why it's so important. You can see an elderly man here, and he is exercising, performing strength training with a dumbbell. And When you take a look at this video, you maybe wonder, why is this elderly man performing strength training exercises with a dumbbell on this age? But this video will show you soon that he has a personal goal for his strength training. And it's Christmas time, and he has family, and he wants to lift his granddaughter up to the Christmas tree. That's his personal goal, and that motivates him performing his strength training. You can see his daughter is very, very emotional. She's very happy too. But what I want to say is, what you train is what you get. So fit and ask help from your therapist or physician to fit your strength training to your personal goal. And it also helps you in motivation and what Ronne said, to keep exercising. Yeah, the next one. As you maybe know, there are some principles for aerobic exercise training, how to perform aerobic exercise training, and there are also guidelines for strength training. But they are more difficult than the guidelines for aerobic exercise training. But the most important thing, what I want to mention, is that it's not only about strength training. Training with no recovery is no training, but is overuse and overtraining. When you exercise, when you perform strength training, your muscles are a bit tired. And there is even a bit of damage in your muscles. But when you take enough rest, when there is enough recovery, then your muscles will heal again. And when the strength training was not too demanding and the intensity not too high, there can be even supercompensation, which means that your muscle will become stronger. But again, a disclaimer, in FSHD and also in other neuromuscular disease, a positive effect can be to be stable or to decelerate disease progression. So it's not always possible to become stronger. And it's important to know this phenomenon, because otherwise you would lose your motivation, because everyone around you without FSHD is becoming stronger and you are still able to perform the same strength training, but you are not becoming stronger. But that's also a positive effect, or even the deceleration of progression. So be aware that supercompensation is not always possible, but it's very important to apply enough rest. And we know, at least after aerobic exercise, that the recovery time is higher for patients with neuromuscular disease, including FSHD. And as you remember, you are already top sporter in daily life, so there is less time left for recovery. So be aware that you apply enough recovery. And of course, an important question, how do I know which recovery time is enough? Therefore, I always say start low and go slow. For example, start with only one repetition of with a dumbbell of a biceps curl once a week, and then the next week twice, and then twice a week, because then you know I have enough recovery, and you can also feel it a bit in your muscles. You do not have to have a lot of muscle pain. In contrary, the higher the level of muscle pain, the more need for rest and recovery, because you can see it as your muscle has a bit of damage and it has to be repaired. And if there is a lot of damage or a lot of muscle pain, you need protein and different supplements to recover your muscle. And then you do not have protein anymore to be stronger. So it's better to have a little bit or even no muscle pain, to have that supercompensation instead of a lot of muscle pain, because then you need all your rest and all your protein to recover again up till the baseline level. Next one. Because of the interviews that Ronne performed in patients with FSHD, we learned that there are different things about strength training and also other lifestyle interventions. It's because it's of motivation and discipline. And a lot of top sporters have a lot of motivation. They love exercise, and that can be also have a negative effect, because when you have a lot of motivation for exercise and strength training, you are prone to overuse because you love exercising. But some people do not like exercise, and they maybe find it boring. And then you need discipline. And discipline means, for example, performing your strength training on the same days in the week, for example, Monday, Wednesday, Sunday, with the same people, with a physical therapist or coach. And what we also noticed in the interviews, there is a group with a lot of motivation and with a very good body feeling, and they want to perform exercises by themselves with their own exercise scheme on a day that they want. And there is a group who is less self-confident and want guidance. And we also interviewed a group of patients who didn't perform strength training very well, or in other words, they had negative effects of strength training. And it appeared that there was a mismatch in that group. There were a patient with a high motivation, but also they want to perform strength training themselves. And they had a coach or a physical therapist who wanted to guide them. That doesn't work. Also the other way around. If you are less self-confident and want guidance and you do not have a physical therapist or coach, that is also not working. So think on yourself. Do I have a lot of discipline, or do I have a lot of motivation, and what fits the person I am? And then the other important thing is it's always good. Exercise is chronic. When you want to perform strength training exercises and want to have an effect, you cannot do it 1 week and then not anymore for the next weeks in the year. You have to have a structure, and a structure of which you think that will fit every week in the year, or at least 45 weeks in a year. For example, strength training twice a week, that's manageable in my current week. But 3 times a week, that's maybe difficult. Then choose twice a week a strength training scheme. It's better to perform a strength training scheme which fits in your daily life than to choose a scheme of which you now already think that will not fit my weekly activities. Yeah, next one. Then my last slide, and then I will hand over to Ronne again. And that's maybe the most difficult one of this presentation and webinar. And that's the difference between central and peripheral fatigue. In the Ronne University Medical Center in Nijmegen, the Netherlands, we performed a lot of studies on central and peripheral fatigue in, I think it was 2010, 2015, also in people with FSHD. And it appeared that the level of central fatigue is relatively higher in people with FSHD than in people without FSHD. But what is central fatigue? Central fatigue is about the signal which your brain sends to your muscles. And if you experience central fatigue, then your brain sends less signals to your muscles. And the cause of central fatigue can differ. It can be a less self-confident, it can be a stress because of work, or family, or it can be because of fatigue or pain. Or in other words, it's a decreased signal from your brain to your muscles. And you do not want to have central fatigue, because when you want to perform strength training and when you want to perform daily life activities, you want to have signals to your muscles. So you want to prevent stress, pain, fatigue, etc. You want to have peripheral fatigue. Ronne showed in her research that all these people who perform strength training successfully do have a bit of peripheral fatigue. They were exercising, performing strength training beyond their fatigue threshold. And with the peripheral fatigue means your muscles are becoming a bit fatigued, but that's needed to become stronger. And the last important thing is that we saw in recent research last summer during gait analysis. So we performed measurements during walking in patients, also in patients with FSHD. And it appeared that central fatigue is higher in muscles which are relatively more weak than in muscles which are relatively more strong. Your brain seems to protect your weak muscles. So if you, for example, are walking and your calf muscles are weak, then your brain decreases the signal to your calf muscles and increases the signal to other muscles, for example, your quadriceps muscles. But there's a risk. The two risks. The one risk is that when you decrease the signal to your calf muscles, then your calf muscles are not very well activated anymore, which can lead to disuse later on. And when the quadriceps muscle is highly activated, it can lead to pain and overuse. And how you can prevent pain, overuse, and disuse is to match the exercise intensity and to match the daily life activities to your muscle strength. And I promise you that we, with our research, will help you in the future to match your capacity with your muscle strength. And now I will hand over to Ronne.
Thank you, Nicole, for the great explanation. I have a few more practical guidelines for the strength training, and the first one is train the muscle you want to train. For example, I want to train my biceps muscle, then I need to make sure I do an exercise that is specifically for that muscle, but also generate some surroundings that make sure I can train my biceps muscle. Because if I would do a really complex movement while I'm sitting on a ball, for example, and I do some rotations and make complex movements, then I might be moving all the muscles in my shoulder, which might sound really effective, but you have some muscles that are really weak, some that are really strong, that really overtake the exercise. So then you might not train your biceps muscle specifically, but maybe your compensation mechanisms. So, for example, in this picture, you see people making a plan. I want to draw a horse, but the result is much worse. And that could also be like, I want to train my abdominal muscles. But in FSHD, we know that quite a lot of people have trouble training their abdominal muscles. When they do so, they might compensate with their neck muscles, their chest, their back, their hip. They compensate with everything and not train according to goal, training the abdominal muscles. So you really need to match the exercise with your plan. In this case, you can maybe start laying on your back and bending your back so you can contract only your abdominal muscles. You know how to contract them. You can feel it with your fingers, and the rest of your body can be relaxed if you lay on a comfortable mat or something. So the first advice here is really train the muscle you want to train. And then you also need to think about how your body reacts after the training. So if I did abdominal exercises and biceps exercises, like I just told you, but the next day I have a lot of extra pain in my neck muscles, then that definitely means that you have compensated during your training and that you didn't do the exercises in the correct way. So how your body reacts really tells you something. If after the biceps training the next day you have a little bit of pain or fatigue in your biceps, then you know you really did the exercises according to your plan and your goals. So listen to what your body says the next day. You can learn a lot from that. And the next thing is, if you struggle with compensation mechanisms, you can think about isolated or supported training, or you can use aids. So in these pictures on the left, you see a woman doing a very difficult exercise. She's training her legs, her abdomen, her arms, everything all together. And that can be really hard because your muscles can be confused which muscles to activate and when. So on the right side, you see a person doing a biceps curl. And maybe it would be even better if the bench he's sitting on was a little bit bigger. It can help if you support your scapula or your shoulders to have more stability there. and maybe even support for your head. So that can already help you to relax your head and neck and shoulder muscles during that exercise. And you can really focus on your biceps alone and really decrease the chance of compensation. So in this case, shoulder support can help, or maybe you can do exercises lying on a bed or mat or something, or maybe some braces or even aids can really help you to do the exercise like you want to do. And my last slide is that you really need to take your time to find the correct training intensity. You cannot say after one training like this was definitely good or definitely not. The people we observed in the training really had years of experience of learning what your body tells you, and they responded on that and adapted their training accordingly. Also in this picture, you see a doctor saying, I have 20 years of experience with FSHD and training, but you as the person with FSHD, depending on how old you are, you can have 50 years of experience with your body or more. So in summary, during the training, it's really important to feel where you feel the exercise. Does that match what you were planning to do? You need to think if it matches your goals and if it is according to the plan. And if it's not according to the plan, you really need to act on it and make changes accordingly. So yeah, that was our final slide. And I think it's time for the questions now.
Yes, thank you so much, Nicole, Ronnie. We really appreciate that. And thank you everyone who has submitted their questions so far. We'll go ahead and get started with this question. Has there been any research into whether or not focused strength training accelerates the disease? I seem to remember hearing in the past that strength training was harmful.
Yeah, thank you very much. Interesting question. There has been research that strength training is harmful, but that was research in mice, mice which were running and performing activities whole day long. But even if the cyclists in the Tour de France top sporters are exercising whole day long, they will show muscle damage. So muscle damage is always possible, but only when you perform exercises not in the right way. And there was a study in the very, very past which showed that people with FSHD who were right-handed had less strength in their right hand. So the conclusion was because they use their right hand more than their left hand, that leads to a decrease in muscle strength. But it was not a very good study. But there has been not any study that shows that strength training can accelerate the disease, but you have to do it in the right way, so with enough rest to prevent overuse and overtraining.
Thank you. And kind of aligned with that question, another one, a physical therapist researcher informed me eccentric exercise in mice damaged muscle. How concerned should we be about eccentric contractions with FSHD?
Yeah, that was the same study with mice who performed a lot of eccentric exercise, which is also not good for mice. But we as physicians and therapists are very afraid of eccentric exercises. But one therapist once told me that we have to be aware that when you are sitting down or sitting in your chair, and when you're walking down the stairs, you are also performing eccentric exercise. So we are also, you with FSHD, performing eccentric exercise in daily life. And so we cannot prevent performing eccentric exercise. But when we perform eccentric exercises in strength training, we know that it's in people without FSHD very effective, but that's because you will damage the muscles a bit more. But also in people without FSHD, it's not recommended anymore as a lot as in the past, because what I told you before, the higher the damage in the muscle, the more time you need, the more rest you need, the more supplements and food and protein you need to recover and to have an effect. So don't be afraid that you damage your muscles when you perform eccentric exercise. But when you perform strength training exercise, I wouldn't recommend to do it on a structural basis. But that's based on the knowledge we know now, because maybe in a couple of years we think it's very effective too in FSHD. But because it leads to more damage and you need more time to rest and build up your muscles, which you not always have in your daily life, please be aware, at least during exercise, to perform eccentric exercises.
Thank you. How often should a patient do strength training, and how long should each session be?
Could you answer that question, Ronne?
Yes, of course. It's very depends on your personal goal. In a study, we had one woman who was very busy with her work and everything. She trained once a week, but very heavily. She was the person who had to recover for 48 hours. So she had once a week, 1 hour. We also observed a woman of, I think, 72 years old, and she trained, I think, 3 times a week. And the days she was doing the training, she felt the best. Her intensity was way lower, and she just did the exercises to feel better, keep her body moving. And she was not giving the really intense training stimulus, but she used it more to activate herself. So you really cannot give any guidelines here. It really depends, like, do you want to do aerobic training as well? Do you have, what are your specific goals? And you need to look how fast your body recovers and how much symptoms you have afterwards. So yeah, I think it's a personal answer, so unfortunately.
No, appreciate that. Can you explain what eccentric exercises are? I know that we asked that in the
Oh,
previous question.
yeah, thank you, because not everyone knows. Let me see. I can see if I can show. Yeah. If you are performing biceps curls, then you can bend your arm like this way. This is concentric. And when I extend my arm, then it's eccentric. The muscle is becoming longer, and it's a little bit like this, pulling away all the muscle fibers from each other. So the muscle is becoming longer, and concentric means the muscle is becoming shorter. And because the muscle is becoming longer in eccentric exercise, it's more prone to damage. When you are climbing the stairs, it's concentric, and when you go down, it's eccentric. And sometimes I ask my students if I will organize a running competition, and half of you have to run uphill and half of you have to run downhill. What will you choose? And the best students will answer, I want to run uphill, because the students who will run downhill, which is eccentric, maybe during the competition it's going okay, but the next day they will not be able to walk anymore, because there is a lot of muscle damage because they have performed a lot of eccentric exercise. And that's also, talking about that, very interesting, because why are they not able to walk or climb the stairs after the competition, after they've performed eccentric exercise? That's because of the brain. The brain notices that your muscle is a bit damaged. So the brain doesn't want you to exercise or move these muscles which are damaged. So that muscle, the brain, is a very, very important thing in your head, which helps you in protecting. So don't ignore signals of pain and fatigue, because your brain is telling you something. Be aware, you have to take a little bit of rest to recover from your exercises.
Thank you. And actually, there was a question that tied into that a little bit. Would you have any concerns about encouraging eccentric training or training to fatigue?
Yeah, also a good one. What Ronne showed is that you have to have a little bit of fatigue inside your muscle for a training effect. Yeah, how can you, because there's a lower threshold and upper threshold. And the lower threshold, that's enough to have a training stimulus, and there's an upper threshold. You have not be beyond that upper threshold, because then you have overuse and damage. There are several advices. When you notice that your daily life activities are decreased, or that you cannot perform your daily life activities anymore, then your training intensity is too high. For example, if the running downhill, the people are not able to walk or climb stairs anymore, that's a competition and that's no exercise, because if you perform these exercises 3 times a week, then that will lead to overuse. Ronne also told about repetitions in reserve. That's another word for how many repetitions can you still perform after your exercises. For example, the biceps curls, if you perform 3 times 10 repetitions, and after these 10 repetitions, I will ask you, what do you think? How many repetitions can you still do with the right technique? Be aware, with the right technique. So not like this, but with the right technique and coordination to prevent compensation. And then the answer has to be 1 or 3. Because if you are still able to do 20 repetitions, then the exercise intensity is too low. But if you are not able to do any repetition anymore, then there's a high risk that you will do it not in the right way. What Ronne told you, are exercising the wrong muscles, compensation, pain, overuse. And Ronne also told you that patients, up till now, we advise patients to perform 20 repetitions during strength training because we thought it was more safe than 10 repetitions. But it's not always the case, because even in 20 repetitions, when you're not doing it in the right way, with not the right technique, with compensation, it can lead to pain. And another reason is that when you perform 10 repetitions, it's more easy to know how many repetitions you can still do, 1, 2, 3, than when you perform 20. Then it's more difficult if you are still can do 1 or 3 repetitions. So I've lost the question that I've answered a lot. Oh, it was about the intensity. So there are several guidelines. So how many repetitions you can still perform. Your day life has not be influenced by your exercise. And Ronne, do you have any other additional advice?
Yeah. So you advised about the 1 to 3 repetitions in reserve, and in the study we also saw people training until failure, so they really had to push out the last repetition. Those people were experienced and they knew they did not use bad compensation mechanisms. So that's maybe not the advice when you start doing strength training. Of course, you can start with much more repetitions in reserve, but in the end, training until failure, we have seen that is possible if you really want the training effect. We had some people with FSHD telling us, I see my biceps muscle grow, I see I'm really getting stronger. So if those things are your goals, then you should really think about your high intensity. But that's definitely not maybe the case for everyone.
And there's another thing in which you can see or feel that you have a little bit of muscle fatigue, and that's that your last repetition has a lower speed. So when you do your biceps curls and you feel that the speed is decreasing, then that's also a sign of muscle fatigue. But I cannot say it enough that please be aware that you're performing it with the right technique. So perform your exercises in front of a mirror, or ask your partner. Or we have a patient and her daughter helps her, and her daughter is taking a look at her mother, how she's performing her exercises. And when you see that the coordination is different or the technique is different, then please stop, because that's compensation and that can lead to pain and overuse.
Excellent. Thank you. Are there particular signs that an individual with FSHD should look at in terms of slowing down muscle weakness or fatigue pain? Maybe they should stop if they are exercising.
Stop with strength training or stop with exercising?
Yes.
Yeah. Can you answer, Ronne? Or shall I begin?
Yeah.
Yeah, there are when you one important thing is when you it's important to that you perform the same repetitions and the same weight. And when you notice that, for example, when you are performing biceps curls with 10 pounds, when you notice that you're not able to perform these exercises anymore, and maybe it's only possible with 5 pounds, then consult your physician or therapist if you don't have one yet, to see what's the cause. Because maybe you have less muscle strength or you're not doing it the right way. So that's a sign that you're not to be aware. Another thing is, again, compensation. So when you're not able to perform the biceps curls, it's just an example because it's the most easy exercise to show you on the screen. But when you're not doing it the right way anymore, that's also a sign. So you have to lower your repetitions or lower your weight or increase your rest. So there are several signs, and when it influences your daily life activities. And another important thing is you can only perform strength training on a specific muscle when you can move it against gravity. When you can extend your leg in the whole range of motion, then you can exercise your leg. But if you cannot extend your leg in the whole range of motion, then you cannot exercise it without compensation, because when you try to extend your leg in the whole range of motion, you will immediately begin to compensate, which will lead to pain and overuse. So that's also a very important thing. You have to move your leg against gravity, but if you are not able to do that, then there are also alternative ways. For example, when you lie on a bed and extend when you're lying on your side and extend your leg when lying on the side on bed. Because there was another question I saw on flexibility and preventing contractures. Or for example, in the swimming pool, because in a swimming pool, there is less gravity, or the water helps you in moving. It's also a good way to prevent contractures and still move your muscles.
You brought up bicep curls at one point, and so a patient does have a question. If I cannot do an actual bicep curl, could I have someone help lift my hand to the point that my bicep muscle starts to work? Would this be beneficial?
That is possible. And remember that your arm is already a lot of pounds. So also without weights, bending your arm is already an exercise. But a person can help you in bending your arm, but at least in the Netherlands, we also prescribe arm support. And arm support, even robotic arms, do help lift your arm. And a lot of patients are afraid that when they use support, or for example, orthosis or arm support, that their muscles will become lazy. But it's the other way around. We have performed measurements on muscle fatigue in boys with Duchenne, but I believe that the same applies to every patient with a neuromuscular disease. In boys with Duchenne using arm support. And when the boys didn't use arm support, they were not able to move their arms for a very long time. And there was a lot of muscle fatigue and overuse. And with arm support, they were able to use their arms for several minutes without a high level of muscle fatigue. So to conclude, when it's not possible to move your arm or legs against gravity, you can use foot orthosis, walking aids, arm support to still use your arms and legs, activate the signals from your muscle to your brain, other way around, but also there are also signals from your muscle to your brain, because your muscle tells your brain, okay, I'm used, so I'm still useful. And when you do, that's because that's the word disuse. When you do not use your muscles anymore, your brain thinks that they are not needed anymore. So therefore, it's also important to still use and move your arms and legs, also when it's not possible against gravity. And again, swimming in the swimming pool is also helpful in moving. Yeah.
I have a small addition there. For example, like I told you in the abdomen muscle, where you can really train them while laying on your bed. So really, when you lay flat, so really think about how to contract your abdomen muscles and really learn the pathway from your brain to your abdomen again. You can also do that, for example, in your biceps muscle when you are laying and you have maybe some heavy thing against your arm that you just have to push against. And then you can really make the movement of elbow flexion without having to make the movement. You do it against something heavy or something strong or a big cushion or something. So you do like you make the elbow flexion, but you don't really need to do it to really learn that signal and contract that muscle. So that could help maybe if you want to train without help.
I think that in healthy people, muscles grow after some small injuries to the tissue, but I'm not sure if this is something we need to pursue with FSHD. Can you please comment on this?
Yeah, I would love to comment on that, but we do not know exactly what's happening inside the muscle of FSHD. Because therefore, first of all, a biopsy is needed, and it's a very painful experiment. And you cannot perform a biopsy after each exercise. And what you do want to do is to see what's happening real time. And therefore, we use a lot of knowledge from sports physiology, exercise physiology, but even in that kind of research, they still don't know because it's still very difficult to know what's happening inside the muscle during exercise. And we do now have MRI, CT scan, ultrasound, and a colleague of us is performing research with mobile, a small ultrasound, which you can use during exercise. And maybe in the Netherlands, will receive a grant for a big MRI scanner in which you can walk and exercise. So that's very nice because I think in a couple of years we know more what's happening inside the muscle during exercise. But even in people without FSHD, we still have a lot to know about what's happening. Yeah.
Ronnie, I think this is a question for you. How would you recommend someone begin strength training if they do not currently already do it? In particular, how might someone who has been recently diagnosed with FSHD but doesn't have the current symptoms, how would you recommend that they start strength training?
Yeah, we get that question quite a lot too. For example, parents asking about their children, like, can they do strength training or yeah, how does that work? And I'm very happy if you don't have for you if you don't have that much symptoms yet, and then you can do strength training almost the same to the guidelines like people without FSHD. I We don't know it from longitudinal studies yet, but I think if you work on your muscles without having the pain and fatigue and the symptom afterwards, it can really help you to become stronger. We know stories of people who see their muscles grow, they feel they become stronger and more fit. So yeah, we really hope that that might help in the long term. So yeah, you can do more general strength training, upper, lower body. Yeah, and I think it can really help you.
Beautiful. And are there any specific exercises that patients should avoid, or maybe that might be more helpful to consider in strength training?
Let me think. For now, we only saw people training with weights or with machines because we needed those type of exercises in order to do all the calculations. And we know lots of people who do also more functional training. For example, if people want to train sitting up from a chair, they could do that exercise sitting up for a chair for a few more times. So that's more functional training that we didn't see in the study yet, but can also be really helpful. We go back to the general guidelines. Everywhere where you compensate or don't use the muscle you want to train is a bad exercise. So sometimes you really have to be creative which exercise fits you. You can have a physical therapist or something help you feel which muscles are contracting. I don't think there's a specific exercise that I would definitely not recommend, but I tend more towards the isolated or functional training compared to more compound exercises. Do you have any additions, Nicole?
Yeah, yeah, there's one thing, also coming back to the last question. We as physicians measure your muscle strength by isometric strength measurements. So for a very short period, 1 second in one position, and then we give numbers to your muscle strength from 0 to 5. And then they say you have a maximal muscle strength, but be aware, because from research we now know that the muscle endurance is relatively more impaired than the muscle strength in FSHD. So even when you have the maximal score of muscle strength, then your muscle endurance, so performance in a longer period of time, can still be impaired. So even if you do not have any symptoms of pain, but it's also applicable to top sporters. You have to listen to your body, and you can have a bad day. So listen to your body, and indeed, what Ronne said, think about the pain and fatigue to manage your exercise.
Yeah, sometimes we people ask us like, how much can I do this or how much can I do that exercise, and we cannot tell you the answer without asking you about how it feels and how the exercise works for you. So we really need the knowledge that's already in you as the person with FSHD, like how it works for your body. That's definitely the most important. So if you learn a way to communicate with your body, that's definitely the most effective, and no therapist can tell you that exactly.
Beautiful. Well, unfortunately, that brings us to the end of our time here. Thank you so much, Nicole and Ronnie. This has been absolutely wonderful. We really appreciate your time. As you can see, we still have quite a few questions because our audience was deeply engaged with this. So thank you all for joining us today. And again, thank you for your time as presenters. With
You're
that,
welcome. I
yes,
still see
please.
a lot of questions. So is it possible to collect these questions and that we answer them on paper later on?
Absolutely. I am more than
Yeah.
happy to do that. We will make sure to send those questions out, and then we'll have a blog of some sort with the
Yeah,
answer to these questions. Thank you so much. We really appreciate that.
you're
Beautiful.
welcome.
Thank you. And for the rest of you all, thank you so much for joining us. We really appreciate your time. We hope that you will join us at our next FSHD University, which will be on September 18th, and it will focus on MRI biomarkers in FSHD, presented by Dr. Seth Friedman. Of course, we also encourage you to look at our calendar for our other upcoming events in your area. We do have multi-chapter meetings taking place at the later part of this month, so we do hope that you will consider joining us there. Thank you, and we will see you all next month. Bye-bye.